So let's start with surgery. Surgery, there's two types. You have a lumpectomy and a mastectomy. In a lumpectomy, the known lump and the surrounding tissue is removed, but the rest of the breast is spared. In a mastectomy, the entire affected breast is removed. Many women who elect to get mastectomies will get a bilateral mastectomy, meaning both breasts are removed because of concern for recurrence in the opposing breast. As far as efficacy difference, initial concern was that maybe the lumpectomies weren't as effective as mastectomies, but recent evidence has shown that there is not an efficacy difference. And some research has actually shown that maybe lumpectomies were a little better. We'll talk about why that might be in a moment. Some patients will have a tumor that's too large to operate on. In those cases, which are usually stage 3 patients, we'll use neoadjuvant chemotherapy to shrink the tumor prior to the surgery. The next question is our patient going to need radiation therapy? We have certain criteria that automatically indicate that the patient will need radiation. The first criteria is if the patient has a very large tumor, greater than 5 centimeters. If that tumor is greater than 5 centimeters, they should get radiation after their surgery. Next criteria is presence of positive surgical margins. So remember that surgical margins are the area around the tumor that was removed. So if there's cancer in those surgical margins, there's a high likelihood that there's cancer left behind in the patient after the surgery. And so in that case, we need to do radiation to eliminate that cancer. Next criteria is if the patient has positive lymph nodes. So if their lymph nodes have cancer in them, the patient will need to get radiation to try to eliminate that cancer. And the last criteria is if the patient elected to receive a lumpectomy instead of a mastectomy. With a mastectomy, we can be reasonably certain that all the breast cancer tissue has been removed because all of the breast has been removed. Versus a lumpectomy, there's still the fear that there could be some breast cancer tissue remaining. And so the patients who receive a lumpectomy get radiation. It's thought that might be the potential reason why patients with lumpectomy may do a little bit better than patients with mastectomy. But that's a question we don't have the answer to quite yet. In order to escape radiation therapy, the patient has to have a small tumor less than 5 centimeters, has to have a mastectomy, has to have negative lymph nodes, and has to have negative surgical margins. So all 4 of those things have to be met in order to not have radiation. So let's talk about drug therapy. Since we're pharmacists or are going to be pharmacists, that's where our concern is mostly. Almost all patients are getting chemotherapy in breast cancer. Patients with small tumors less than a centimeter may not need it, but most everyone else is. There isn't one specific regimen that is most used. Are most recommended for breast cancer. There are several regimens that are common. We do know that the anthracyclines and the taxanes are the 2 most active classes of chemotherapy in breast cancer. And once again, if the patient is HER2 positive, the patient will receive trastuzumab as part of her regimen.